Good morning and welcome to the third annual Digital Health Society Summit. The summit takes place against rising COVID infections and a continuing challenge to our health and well-being in the widest possible sense of the words. I'm going to quickly tell you about 6 things. Firstly, 1, who is attending today? 2, who, what, and the why of the Digital Health Society. 3, about the themes of the summit. Health data for society, a little bit about the DHS and the IHD roundtables, some comments on day 1 and 2, and some concluding remarks. So first of all, it's virtual again. And in the words of one of our partners, the American Telemedicine Association, it's health virtually everywhere. A benefit of the virtual summit is it allows the involvement of attendees from around the world. Today, we have 708 registrations from 68 countries, 26 member states, 29 national or regional health ministries, 48 speakers, and attendees from many of the ECH Alliance ecosystems and their members, and registrations from all stakeholders involved in health and care. And by all stakeholders, I mean the health system, primary and secondary care, regulators, ministries, policymakers, social care, education, local authorities, the voluntary sector, funders, industry, including health and social care providers, pharma, medtech, and tech, as well as other sectors many of you who do not realize are involved in healthcare, such as maritime, automotive, aviation, and space. I hope some of you are familiar with the ECH Alliance ecosystem diagram, which illustrates the all stakeholders approach and works to join the dots between them. This summit is a forum to bring together all of these stakeholders. The scope of today's attendees is illustrated also by the job titles of the attendees, which include officers, managers, directors of policy and government affairs, chairs, CEOs, CTOs, CMOs, CCIOs, founders, chief digital officers, and one of my favorites, a challenge director. We have professors, lecturers, researchers, and students. We have 80 universities and research organizations. We have data scientists, informaticians, health economists, doctors, nurses, pharmacists, dentists, physios, engineers, and finally, heads of innovation, communication, and business development. So the who, the what, and the why of the Digital Health Society. It's a legacy of the Estonian presidency of the Council of the European Union in 2017. And we are delighted that we had 2 Estonian speakers at the summit who helped set up the DHS. The DHS works with presidencies interested in digital health. We have 4 main activities: this annual summit, our digital and data roundtables, our data and digital work with the Global Health Connector, and international collaborations in Europe, such as All Policies for a Healthy Europe and the EU Health Coalition. So the theme for this summit is health data for society. The pandemic has illustrated how important health data is for all of us. But health data is not just patient data. It's not just public health data. It's not just health data itself. It's not just consumer data, but data from other sectors such as transport and the environment. Data for society, for people, communities, and societal benefit. Compacts and data as a common good is something the next session with our roundtable will touch on. Society is global. Healthcare should know no borders. So we're delighted to be showcasing the work of the Global Health Connector and the opportunities it will create for all stakeholders. 2020 was a busy year with roundtables. Roundtable 1 was the acceptance criteria for societal trust in the use of health data. Roundtable 2 was a recipe for trustworthy digital health, standards, architecture, and value. These 2 roundtables led to the calls to action, which we published in February 2021. In 2022, we've had the two further roundtables. Roundtable 3, progressing a common basis for health data across Europe, which is the subject of the next session. And Roundtable 4, which we're just completing, which was on scaling up the availability and reusability of big data. A few thank yous for the roundtables to every attendee without whose expertise, knowledge and help it would never have happened. Our event sponsors, Johnson & Johnson and Microsoft, and to IHD and Deepak Kalra, who partnered with us to make the roundtables happen. So I'd like to say some comments about day one and some of the sessions. We have an introduction to the e-health network and the development of the COVID passport. We have from the European Commission an update on the European health data space. We have an introduction to the Global Health Connector, and we have an important panel on the European health data space, the latest hopes and wishes from patients and trade associations. I pick out this panel because this panel is about collaborating. We started the collaborative approach in the first Digital Health Society Summit in Helsinki. So I'm delighted that COSIA, ETEL, MedTech Europe, All Policies for a Healthy Europe, FBIA and EPF have all accepted our invitations to speak today. I'm convinced that if we work together, we will achieve more for the benefit of citizens and we will be stronger together. I'm excited about the panel discussing the role of the EU presidencies and how relationships between presidencies, the Council, the European Commission and Member States could be even more effective. Finally, I recommend you do not miss the last session today when we are delighted to have the French Ministry of Health confirming and outlining their work and plans in digital health. And France, of course, has the EU presidency from the 1st of January to the 30th of June next year. In relation to day two, my colleague Carolina will MC the day and outline the session when she opens it tomorrow. The theme for day two is innovation, communities and ecosystems. But I do want to highlight the fireside chats when three of our female professors and DHS directors take to the stage. Angela Brand, Marita Perla-Heap and Rachel Dunscombe. We are very lucky to have them and we are delighted to showcase their expertise and work. So a few concluding remarks. Please visit during the summit the 23 virtual showrooms to find out about the organizations exhibiting and the work that they are doing. The ECH Alliance ecosystem needs members to solve the many challenges each ecosystem has. So whatever type of stakeholder you are, if you are not a member of the ECH Alliance, please join. Have a look at the details in the ECH Alliance showroom. I'd like to thank finally our partners, J&J, Microsoft, the Africa Healthcare Federation, ATA, Health, the Commonwealth Centre for Connected Health, the Health Parliament, ORCA, IHD, and the Vodafone Centre for Health with Deloitte for their support. I hope you enjoy the summit, and I would like now to introduce you to Deepak Kalra, who will take us through for the Roundtable 3 panel. Thank you.